Okay, we're up to quite a good number, so I think we'll probably get cracking. The first few minutes is only just going to be introductions and kind of housekeeping anyway, so hopefully people will join us as they get to us. Firstly, welcome and thank you for joining us for the third in our series of our webinars. This webinar, we're really looking at support worker competency, education and career development framework, but from the perspective of managers and AHP leads. So my name's Abby Hall and I'm one of the Devon AHP faculty leads. And I'm really delighted today to have three people joining us to present. So we've got Richard Griffin, Gabby Ford and Lorraine Allchurch who are all going to present today. I'm not going to introduce them, I'm going to let them introduce themselves as we go through the presentations. Just some really brief housekeeping that we're probably all aware of by now. If you can remain muted unless you're speaking, that would be absolutely brilliant. Please just raise your hand or write in the chat if you've got any questions as we go through. We're going to have a specific Q&A after each of the presentations, so you can ask lots of questions then, hopefully. We are going to record this session and it's going to be uploaded to our YouTube channel along with other recordings from other webinars that we've done. Finally, if you haven't done, there's been loads of introductions in the chat, which is great. Thanks, guys. But if you haven't introduced yourself, please just pop in the chat who you are and what your role is. That would be absolutely great. Just before we get cracking, I just want to just introduce really the rest of the webinar series. So this is the third in the webinar series. The first two we've already done. They've both been uploaded to the YouTube channel, as this one will be. And then we've got one final webinar, which is on the 29th of September. And that one's looking at real focus on those that supervise support workers. So talking about career conversations and how that fits in with the framework. So I'll post those links again at the end, so you've got that if you'd like to join any of those. So I'm going to hand straight over to Richard and Gabby, if that's all right. Can I just ask everyone goes on mute? We've got quite a lot of feedback.
Yeah, apron, gloves and masks. Yeah.
So can everyone hop on mute if that's all right? I know people are joining. Sometimes it doesn't mute you as you join. That's great. So hello and thanks so much, Abby. Thank you for inviting us to join you on this webinar, and really keen to talk about the programme and the implementation of the programme and to be with you. Those of you that haven't met me, my name, as Abby's mentioned, is Gabby Ford. I am an AHP Clinical Fellow working on the National AHP Support Workforce Programme. Next slide, please, Abby. Thanks. So this is what we'll be covering this afternoon, and there will be time, as Abby's mentioned, at the end for any questions. So this afternoon, we're just going to briefly go through the programme aims, then we'll go over a bit of background and spend some time on the AHP support worker competency framework, and then Richard's going to talk about the differences the strategy can make, and then I'll chat you through some implementation resources, and then a Q&A and discussion. But feel free to put questions in the chat box. I probably will struggle a bit to multitask, but also to see the chat box as we go along, but we can bring those in at the end. And I know Abby's on it in the background, so thank you for that. So if we could just move on to the next slide, which is just going to be our animation. So I thought it'd be quite good. We've produced this. This is on our web pages. It's a brilliant summary of what the programme's about. So could we just watch that, please, Abby? Thank you.
Our allied health professions support workforce play an integral role in delivering safe and effective care for service users across health and care. The National Health Education England AHP Support Workforce Programme has spoken to members of this workforce. They've shared that they're not always involved in the plans that affect them. There's a lack of clarity and consistency in requirements and responsibilities between roles, and many want to see clearer pathways for career progression. We need to ensure that our AHP support workforce have the right knowledge and skills, are supported by training and education, and have equitable access to opportunities for career progression. For all of these reasons, we're working closely with our partners to recognise, celebrate and maximise the roles of AHP support workers, assistant practitioners and technicians across England. At the heart of our work is the Allied Health Profession Support Worker Competency, Education and Career Development Framework. The framework is designed to support access to education and career development pathways. It helps employers, networks and integrated care systems to plan, develop and deploy the AHP support workforce in health and care services. It strengthens the development of apprenticeships, and it enables excellent care to be provided to people accessing our services. We've also published a range of resources to help implement the framework. Our work will ensure that patients, service users and their families and carers have access to a skilled and well-trained support workforce. This workforce will have a defined role within their teams and have access to development structures for opportunities to follow rewarding career pathways. Services and systems will have the tools to address the current variations in support workforce roles, banding and progression, with this workforce being at the heart of improvements in service delivery and transformation, including new models of care. We're working collaboratively with the AHP support workforce, employers, NHS England, Royal Colleges, professional bodies, trade unions and other stakeholders. Our collective action will help to improve education standards, access and uptake for this workforce, grow the AHP support workforce alongside the registered workforce, improve retention and reduce vacancies, and improve the diversity of the workforce. Together with our partners, the AHP Support Worker Competency, Education and Career Development Framework has been developed as a key vehicle to achieve the programme aims. Find out more about this programme and the Competency Framework and how it can benefit you by visiting the Health Education England website and searching for Developing the Role of AHP Support Workers.
Brilliant, thank you. So those are our web pages, and we can pop it in the chat box if you want to go back to that and re-watch it, and also download it and use it as you see fit. So just to quickly recap, although it's been summarised in that animation, this is what we're trying to accomplish from the national programme, what our work hopefully will tackle, and it's around these 4 key areas. So firstly, it's about patients and service users having access to that skilled and consistently well-trained support workers who really do have a defined role within their team, and patient-centred care really must be at the heart of this programme and indeed all that we do. Secondly, the AHP support workers have access to development structures that provide opportunities to follow rich, as you can see, rich and rewarding career pathways. And this is what our research has consistently told us, that our AHP support workers have told us this as well, that it's distinctly lacking. Thirdly, that services and systems can address the variation that support worker roles, banding and progression that there is, and I know I won't be the only one on the call that will be acutely aware of this, and I've seen it over my clinical career and clinical practice. And finally, that our work will ensure support worker roles really can be at the heart of improvements in both service delivery and transformation, including new models of care. And this is about transformation. It's looking at what we're currently doing with the staff that we have and then seeing how we can deploy them differently. And support workers have such a lot to offer in terms of improvements in service delivery and also contributing to that leadership around improvement, which I know Lorraine is going to highlight for us all today. Next slide, please. Thanks, Abby. So I thought it'd be worth just popping this up. This is our aim statement for the national programme. It's worth grounding ourselves in this afternoon. This is what our overall aim for this programme of work. I'll just let you have a minute to read it if you're not familiar with it. And you'll notice that this aim is set for 2024. This programme of work is longer term. We have to be realistic. This is going to take time, but this work is definitely well underway already. And I've been in post for a year now, which is unbelievable. It's flown by. Next slide, please, Abby. So this slide is just to highlight the key partnerships that we've been working with and alongside through the life cycle of this programme. As you can see, we've been working with unions, professional bodies and staff every step of the way. And all our AHP professional bodies and trade unions have produced a position statement, which you can see the image of on this slide on your right hand side. If you've not clapped eyes on this, it's definitely worth reading this and to get familiar with it, to see what sorry, I can't speak either, our professional bodies and trade unions have all signed up to and agreed to. And just to pull out that support workers have very much been at the heart of all our work at every level. Next slide, please. Now we're going to move on to the AHP Support Worker Competency, Education and Career Development Framework. Next slide, please, Abby. So underpinning this National Support Workforce Programme is the AHP Competency Framework, which you heard about in our animation clip. And this really is the vehicle that is going to accelerate and help with our programme, our national programme of work. And it was published back in October last year. If you've not had a chance to read it, I definitely recommend that you do. Now, this framework is an enabler, and this slide really does highlight its key purposes. So it's about consistency, it's about standardisation and crucially career progression. It's about supporting transformation and innovation and improving patient care. And it'll allow capacity and capability of support staff to be maximised in both a safe and consistent way, so that the support workforce will be able to work really at the top of their scope of practice. And just to mention, it doesn't replace professional frameworks, but they complement it and it complements them. And that's where our partnership working has been absolutely crucial. Next slide, please. So in terms of the framework itself, it has 8 domains, including knowledge, skills and attitudes around these 8 areas. And these 8 areas include leadership, they include communication, they include public health and person-centred care, and also they managing information. And there are 3 career levels, which you can see from this slide: the support worker, the senior support worker and assistant practitioner. And the recommendation is that these are progressive. So the recommendation is that a support worker at a higher level will have acquired most, if not all, of the knowledge, skills and attitudes in the level previous to them. And it does progress, which is part of that career progression framework, so that people can really see how their careers can move forward. And there are educational levels also expected or recommended within each 3 career levels. And we've also addressed the really important issue of functional and digital skills as well. Next slide, please, Abby. So, as I've mentioned, the framework does set out the recommendation of the educational levels, which you can see on this slide here, of each of the 3 career levels. And these are recommended either on recruitment or shortly after recruitment. Within 6 months is what we've recommended, 6 months of being successful in post. And as I said, it's all the details are in the framework. And this will hopefully mean greater consistency across roles. It will support quality of care and effective delegation, accountability and supervision, with opportunities to grow your own, which Richard's going to touch on a bit later on, and the use of apprenticeships with fair access to those development opportunities, because we do know that support workers can sometimes struggle to get access to relevant education, sort of occupationally relevant education. Next slide, please. So just to clarify what the AHP Support Worker Competency Framework is about, as I've mentioned, it's an enabler. First and foremost, it highlights the importance of the AHP support workforce. It enables good quality career conversations to take place for all AHP support workers. And they really do have the opportunity to access training that they've highlighted they want to complete, that's appropriate and relevant to their role. And this is to enable all our AHP support workforce to provide that excellent patient care by continuous professional development. And by providing this framework, it enables greater investment in training opportunities. We do know from our scoping exercises and our research that our AHP support workers want to see a greater investment in their training opportunities and career development. And just a final point, that the competency framework was developed in collaboration with the existing national job profiles for support workers. So Naomi McVeigh, our national lead for this programme, and Richard, who's going to be speaking to you in a moment, has worked really hard with they did work really hard with an NHS job evaluation group to ensure consistency, and that this framework sits alongside complementing the national job profiles. And Richard's also going to touch on job evaluation briefly. And so the right-hand side of this slide, I just wanted to clarify what the framework is not, what the framework's not intended to do. So firstly, the framework doesn't determine banding or job evaluation. So I'm sure you're all aware, but banding is determined by the job evaluation handbook and those national job profiles that I mentioned. Banding is determined by 16 factors in the job evaluation handbook, and there are different weighting to these factors. So educational qualifications are just one element in the knowledge, training and experience factor of that job evaluation scheme. The knowledge, training and education factor takes into account the qualification levels, but it also takes into account short courses and on-the-job training that's required for the role. And if you want to find out more about that, there are various websites that we can pop in the chat box, but also we did do a webinar on job evaluation, so you can access that via our web pages, and the link to that will also pop in the chat box, but it's also a bit later on in the slides. So secondly, just to highlight that educational levels aren't the same as Agenda for Change banding. There are differing functional skill levels, qualification levels, apprenticeship levels, which can all get a bit confusing. So it's just to highlight that educational levels, there's lots of different levels, and they are not the same as banding levels. And again, we did a webinar on demystifying qualifications, which are on our web pages as well. So it's worth, if you have the time, to catch up on that, and that will hopefully help if you're getting a bit of a tangle around those. And then thirdly, the competency framework's not an additional requirement. It's there to aid and to facilitate professional development discussions and provide consistency across roles and professions. So it provides a steer for opportunities for training. It's not there to match your current job description against, or as a tick box exercise. It shouldn't be used to force any member of staff to undertake specific courses or qualifications that they don't choose to do, or that's not relevant to their job role. And then finally, another key point is that the framework doesn't assume that all support workers want to complete pre-reg degree programs. It really does provide a framework to develop within the support worker roles, which hopefully Lorraine's also going to highlight for us today as well. Next slide, please. And I think that is over to you now, Richard.
Lovely. Thank you, Gabby, and good afternoon, everyone. My name's Richard Griffin. I work at King's College London. As Gabby said, I've been working with the team for over 2 years now, I think, actually developing with colleagues the strategy and framework. Many years ago, I did work with for the Chartered Society of Physiotherapy, so I do have a background with AHPs, although I will confess I am actually an economist by training, which will be relevant later on. What I want to do is really try to answer this question, and we've been thinking about this nationally with the steering group, with professional bodies and trade unions as well, about what actually that strategy, all the elements of it was introduced, what difference will it make to support workers, to service users, to services. So I'm going to explain a bit about how we've tried to answer that question and provide some of the evidence that we've gathered that supports the conclusion that we've made, which is actually this will make a difference. It will make a difference to services, will make a difference to registered staff, it will make a difference to everybody affected by the strategy. And I think it's really good news that this is a long-term strategy, because that does give us time to have it implemented and hopefully also fully evaluated. So the next slide, please. I won't read through this slide, but as Gabby's already indicated, behind the strategy is a really clear set of objectives that are about ensuring that support workers have clear job design, that they're clear about their scope of practice, that they are educated with occupationally relevant qualifications, which should enable registered staff to delegate safely and effectively tasks to those support workers, which will mean that there's not only consistency, so whichever service a support worker works in, there's consistency and standardisation around the tasks that they do and don't perform if they're working in similar areas, but also that busy registered staff are able to free up tasks they don't need to necessarily focus their time on because they're confident they have a highly qualified and engaged support workforce that can safely carry out tasks within their scope of practice. So if we get this framework right, and there are many areas where a lot of this stuff is already happening, I should stress, but not everywhere, as we've already indicated. But if we do get this right, these should be what some of the outputs locally should be. Next slide, please. We did 4 things to try to think about what the benefits of those outputs delivered by the strategy would be. We looked at the literature, the research around competency frameworks, around human resource management. We looked at what evidence there was for support workers, AHP support workers. As I mentioned, I'm an economist. We looked at we undertook an economic cost benefit analysis of apprenticeships, because the apprenticeships at all 3 of those levels of practice are going to be really critical in terms of upskilling this workforce, in terms of ensuring they do have occupationally relevant qualifications. And as I'll explain in a minute, we did look at the level 3, the senior healthcare support worker apprenticeship, which might typically be completed by someone at band 3. We looked at that one specifically, and we looked at what the cost of that was, but also what the benefits are, and we have attached a figure to that. We also have the expert group that oversees the strategy, which includes professional bodies. We looked at their insights, and Lorraine's part of that group as well. So we did ask support workers as well what they thought the benefits, as well as that wider group, would be from delivering the strategy. So we pulled on those insights. We developed a theory of change. And if you're not familiar with theory of change, it's simply a set of logical steps that begins with inputs, which could be physical resources, it could be time, it could be strategies, advice. It then looks at immediate outputs of those, as we've discussed, then the short-term outcomes and the longer-term impact. So we did develop a theory of change around the strategy. We've not published that yet, but I'll put my email address in the chat box later. And if you'd like a copy of that and the economic evaluation, we'd be happy to kind of share that with you so you can see the full detail of what we did and how we developed it. Next slide, please, Abby. So just to say, there is, from the evidence, and this includes research that's been done in healthcare, and I'll explain or describe a couple pieces of research to back this up. But there is very strong evidence that if you address some of those issues that support workers can face, which this strategy seeks to address, like job design and access to education, there's very strong evidence that you have improvements in organisational outcomes. However, as we've already seen, as the animation at the start showed, support workers, this is not just unique to allied health professions, it's true across many support work occupations, but support workers do not always experience what is described as good work. So they don't always have well-designed jobs, they don't always have access to the education that they require, for example. And he, about 3 years ago, commissioned the University of Cumbria, and this research is published on the HE website, to look at support workers in allied health professions. They found some fantastic examples of great practice, but it also confirmed that those issues that had been identified do exist for AHPs. So if you want to look at some of the research based specifically around AHPs, that study is on the website. Go to the next slide, please. So some of the evidence, and this is directly drawn from healthcare, so it's not from the private sector or other parts of the public sector. It's explicitly research that has looked at, peer-reviewed research that has looked at the outcomes arising from introducing HR programs such as competency frameworks, such as occupation relevant education programs. What it shows is that they deliver high levels of job satisfaction, greater employee engagement, a third lower sickness absence, and higher patient satisfaction. Another study, Western Dawson, found strong links also between patient experience and staff engagement, and that follows through to clinical outcomes like lower falls, like lower infection rates, but also actually lower morbidity rates as well. So there is a link not just between the impact on staff, but on clinical outcomes as well. So I say there is a good evidence base, and if you'd like to see the full report and the full summary of the research we looked at, drop me an email when we finish the discussion. Next slide, please. So what we did, drawing on all that evidence, the literature review, the insights from the expert group, was try to summarise for each of the stakeholders, if you like, from the strategy, what the benefits are likely to be if the strategy is fully implemented. And the end one there around service user is the ultimate outcome of this. It will, evidence suggests, improve continuity, for example, reduce waiting times. But from all perspectives, there are substantial benefits which outweigh costs in terms of perhaps time to look at job descriptions, for example. From an employer point of view, this will increase capacity, it will reduce turnover. And we do know actually that can be an issue, particularly with support workers, that actually retaining staff can sometimes be a challenge, and turnover rates can be relatively high. It will reduce absenteeism, it will increase productivity. Also leads to innovation as staff feel more engaged, more involved, better valued, and support workers don't always feel valued. Then that has benefits in terms of people being able to, for example, speak up in meetings, have the confidence to describe ways they think that services can be improved. It should also lead to a reduction in agency staff as well. So there's a wide range of benefits, return on investment, if you like, that the strategy will deliver if you implement it. Next slide, please. As I mentioned, I am an economist, and we did look at the cost benefit of introducing the senior healthcare support worker apprenticeship. We looked at that one because it has a distinct therapy pathway on it, as well as nursing and midwifery ones, but has a distinct pathway for therapy. There's also one currently being developed for radiography that will emerge hopefully within the next 12 months. So radiography support workers can also have a dedicated pathway. We think that this apprenticeship, which is equivalent to A levels, is probably going to be one of the most important for AHP support workers. So we modelled a Band 2 member staff completing that support worker apprenticeship and then being regraded to a Band 3 on completion. That apprenticeship takes 18 months minimum to complete. It will be paid for outside the apprenticeship levy, which every trust pays. And we looked, there's a range of ways that it can be introduced. For example, you can fully hand the levy over to an external provider. They provide all the training, or you can actually co-design it with and co-deliver it. So I think there are practice educators on this course. So you could, for example, work with your local college or independent provider to jointly train support workers around this apprenticeship, in which case you get some of the levy back. So that's why there's a bit of a range there in terms of benefits. But over a period of 10 years, if you invest in this apprenticeship, then the return per year per apprentice is between £1,000 and £7,000 a year. So we can attach a financial return on investing in education. Next slide, please. Just one slide. Gabby mentioned grow your own. I think if there was a sort of term that summarised the whole of the strategy, is actually grow your own. And there's 3 elements to grow your own, and there's a dedicated resource that describes these approaches within the strategy. The first one is about bringing people in from local labour markets. There may be college students, there may be people long-term unemployed, there may be school leavers, there may be career changers. But there are people who live in localities, who may be studying in localities, who may not always be aware of the careers that are available in the NHS, and certainly the careers that are available in support worker roles. It is the case that many college students, even though studying healthcare qualifications like BTECs and now technical levels, don't go on to work in health or social care. So there's something around engaging local skills and labour markets to raise awareness about NHS careers, including support worker ones. And also targeting those groups who may be disadvantaged, is where the Anchor Institute role, which you may have heard about comes in. So actually there are people who experience barriers to work, for example, people with disabilities, but who are able to work with the appropriate support, and there are plenty of agencies like the Prince's Trust that can support that. There's one element is looking to the future and bringing people from local communities into the NHS, and there's other benefits for that as well. It means workforces are more reflective of local communities, and there is evidence again that actually having a more representative workforce does deliver better outcomes. When people are in work, and this is the focus of what we're talking about today, Grow Your Own is about in-work development and making sure people can be the best that they can at whatever level they work at. And finally, it's that career progression, moving from the inside up, and that includes access to pre-reg degrees. We know a lot of AHP support workers would like to be registered staff. We know, for example, that 50% of diagnostic radiography support workers would love to be registered radiographers. We know 3/4 of dietetic support workers would like to be registered professionals, but don't always know how they can progress their careers. So that's a really great potential pool of future registered staff that are already working in the NHS. So part of the strategy is about how we actually help them progress their careers, those who want to and are able to, and some of the support they might need. And that's also about building relationships locally with universities, for example. So we would particularly draw your attention to that aspect of the strategy. It is really about how you grow your own workforce at all levels and secure your future workforce, but also remembering this does have a link to registered staff. So just finally, next slide, please, Abby. Just to re-stress the point about job evaluation, and a couple of slides about job evaluation. Next slide, please. As Gabby said, the framework is, we did take account of the job evaluation profiles. We did look at what they said around common competencies and skills such as competencies, but the job evaluation scheme and the framework are different. It'd be very possible to be mapped against the senior support worker level of practice within the framework and be graded band 2, for example. So there's not a direct equivalence between the framework and job evaluation. But as we said in the guide, and is the case, it is important that job descriptions are up to date and reflect the work that people actually undertake. Next slide, please. And just to stress that the framework has 8 competency domains. The job evaluation factors are 16, so there's already a difference there. Competencies are different to roles and responsibilities. The job evaluation system talks about tasks, it talks about roles. We talk about knowledge, skills and attitudes, competencies. And as Gabby's already said, levels of education are not equivalent to pay bands. So we do talk and we do try to standardise what we'd expect at each level of practice. Support workers to acquire an appointment or subsequently once they've been employed, but those do not automatically flow through to a pay band. And it is important because we don't want to raise expectations or people to be confused about the relationship between the framework and job evaluation. So I think that's the end of my section. I'm going to hand back to Gabby now around implementation.
Brilliant, thank you, Richard. So I'm just going to do a whistle-stop tour about what implementation support there is there for you. Next slide, please. And just to this always amuses me and brings a smile to my face, this slide. So just to highlight that we do know that publishing, and I'm sure you guys are fully aware, publishing the framework won't lead to automatic implementation of the framework. It's going to take time, and crucially, it's going to take support. And as this slide highlights, it doesn't just happen. Unfortunately, national policy won't necessarily mean real change. It takes support and commitment to supporting the implementation of this. And it's probably a good job, otherwise me and Richard would be out of a job. Next slide, please. So here are some implementation resources to help. Richard's already touched on Grow Your Own strategies, and we've got a quick guide which you can see on this slide called Grow Your Own Strategies. If you want to dip further into that, please do head over to our web pages, and I popped the landing page on the chat box, so you can click on there and then just click on the resources tab and all of this will be there. We've also run 4 national webinars to support the implementation of the framework. I've already mentioned a couple of them, so do look to our web pages again, and it's under the webinars and events, I think, section, and the slide decks are there as well. And as I've mentioned, we ran 1 webinar on demystifying qualifications to complement the Understanding Education Qualifications and Development Guide, which you can see on that slide, and also making learning work for AHP support workers. So do if you have the chance, go and have a look at those. Next slide, please. So I wanted to spend just a few minutes on the readiness toolkit. So the toolkit really does provide a suggested step-by-step approach to implementing the framework. If you've not dipped into this, I would recommend that you do, because it really does help. It breaks it down. And this approach, this step-by-step approach, is set out for all implementers. So it's designed to help regions, it's designed to help integrated care systems and AHP faculties, and it's designed to help employing organisations, which I know is mainly the people with us today. And it sets out key questions for you to consider and address, along with ideas for next steps that will help plan your local priorities and projects. And pages 6 and 7 are practical steps, which are broken down into 6 key steps and go through from starting out right through to handing over and sustaining your improvements. And in this section, it really does talk about also utilising quality improvement approaches, such as the model for improvement, which can help with these practical implementation. The toolkit also includes a collection of links to profession-specific resources and guidance. But I'd also just say this got published back in autumn last year. So also look to our web pages for profession-specific resources, because stuff that has been produced since autumn of last year will be on there, and it's worth having checking those out. Next slide, please. So how to use the readiness toolkit. As I've mentioned, it's got key questions. I think it's quite straightforward. The key questions are for you to consider, to prompt, and this is done both at region, system, and then more locally, which will be the relevant bit for you guys on this webinar. But it is worth looking at those regional and system questions as well, because then you can see what work's being done within your region and also within your AHP faculty or your ICS, ICB now. So it's recommended for best results that as an ICS or a faculty, a senior lead heads and oversees this work. So this could be an ICS, or in your new ICB format, an AHP lead or strategic workforce lead. It could be chair of AHP council or chair of AHP faculty, depending on your infrastructure and faculty maturity, which we know are very different. And this is where Abby and colleagues in Devon come in. It's recommended to look at all your key stakeholders, really, such as your practice education leads, apprenticeship leads. They're a wealth of knowledge, and other workforce stakeholders. So not just AHP leads and support workforce. Make sure you look a bit wider. And as I've already mentioned, consider those suggested practical steps that are set out on pages 6 and 7. And the information gathered by doing all of this will really help you in your understanding of your current support workforce and the qualifications, competency and skill mix to meet your patient or your people needs. And also don't forget all the work that's already happened or is being undertaken as the result of the funding that went into faculties and also went into providers for the National AHP Supply Strategy Implementation Project work has really accelerated your information and data gathering around your current support workforce, both at provider level and AHP faculty level. Next slide, please. So here are the key questions. This is what it looks like. I'm not going to go through them all now because there's quite a few of them, but these are the pertinent questions recommended by the toolkit for NHS trusts and other employers. You can go away and have a look at them. The toolkit's designed to keep going back to, so there'll be areas where you think, all right, yeah, I need to start there, or there might be some quick wins that you think, oh, actually there's a bit of energy, a bit of momentum within that area, let's go down that route. And then to keep coming back to it, thinking, okay, where's my blind spots, what have we not done, where do we need to go next? Next slide, please. So these are just the remainder of the 19 questions, and as I said, it's something to keep going back to see where you need to go next. And next slide, please, Abby. So the 19 relevant questions are for employer organisations, really do fall into these 5 key areas. So strategy, workforce planning, roles and responsibilities, recruitment and retention, and training and education. So just for example, I'll pick out a few questions. For the strategy, there's question 1, which asks, do you have a collective ambition for developing your AHP support workforce within your organisation? Then with workforce planning, there's another question there about, do you understand the diversity of your AHP support workforce in your organisation? And that includes fair access to career opportunities. So for roles and responsibilities, there's a question in there about, have you used the competency framework to identify tasks and activities that could be delegated to support workers? Within recruitment and retention, there's a question about, do you regularly review the effectiveness of your current support worker recruitment selection and induction processes? And then finally, for training and education, the last question is around, are your AHP support staff included in the Trust apprenticeship planning and delivery, including the allocation of the apprenticeship levy? So those are the kind of, that gives you a bit of a flavour of the questions that are there. And as I've mentioned, it is a guide to keep going back to. Next slide, please. This is our final slide. Just to, here's all the important information about us as a national team that's worth, I thought would be worth having and useful. So Naomi McVeigh is our National Programme Lead. We've heard from Richard, he's our Academic Advisor. I'm a Clinical Fellow, and within the team, there's Soraya Hassan, who is our National Workforce Lead, and we've also got a Project Manager, Loretta. In terms of the Apprenticeship Lead, it was Gemma Hall, but she has now left, so the Talent for Care team have recruited into that post, so we'll be able to let you know who that is very soon. Any questions or queries at any point, please do email us, and there's the generic email address that gets manned by myself and Loretta daily. And there's the link to our web pages there at the bottom as well, which again I've put in the chat box. And final slide. Over to you guys if there's any questions, or Abby, if there's anything that's been in the chat box.
Super, thank you massively, both of you, for a massively comprehensive presentation. I think it's really important to say that we've got a lot of people here from Devon, but also outside of region, and I think everybody's at different stages of implementation of the framework, so that there are no daft questions. So I think while we've got Richard and Gabby with us, it'd be great to use their knowledge and really share that. So I think there are no daft questions, so please feel free to ask anything. Pop your hand up or pop it in the chat. Got a question here in the chat from Hannah that says, in extra community teams, especially urgent care teams, we need more band 4 roles to be made available, so career progression is very limited. Support workers can only access the AP apprenticeships if they've got a band 4 training role offer, and these are extremely rare in their teams. You got any thoughts on that, Gabby or Richard?
Yeah, I mean, obviously in terms of service demand, business case would need to be made, wouldn't it, in terms of what the band 4s can contribute, and hopefully the framework can give some insights into some of the tasks, responsibilities that those roles can perform. And you're absolutely right, to do an apprenticeship, it has to be to a job. So if that job doesn't exist for that individual, then you can't access the apprenticeship. There's another issue around apprenticeships in terms of having a big enough cohort, and I think that's a slightly different issue to one you're raising, but that's something where I think working the systems can help. It may be only 1 or 2 people in an individual trust might want to or be able to go onto a program, and that wouldn't be enough to sustain it. But if you work across systems, then that gives you an opportunity to raise those numbers. But I think it's making the business case locally for what those band 4 roles can contribute in terms of your service objectives. There's no kind of easy answer to that particular question. I think we are probably using band 4s, generally speaking, less than we probably should do actually in the NHS because of the contribution they can make, and our assistant practitioner apprenticeship is there to develop them. And of course it can be a step into pre-reg as well, although we obviously don't want everyone leaving support worker grades, but yeah, it's going to have to be a business case, I think, and perhaps looking at other services and what they do if you have those connections. I don't know if Gabby or Abby, you've got any insights beyond what probably was quite obvious, but
Oh, go on, Abby.
I was just going to say that obviously we know in Devon we've got difficulty recruiting to vacancies, particularly in OT and also some in physio, but mainly around OT. So I think it's about looking at establishment, looking at skill mix slightly differently. So if we're struggling to recruit to a band 5 post, then looking to see whether a band 4 post might be suitable instead. So I think it's just starting to have those thoughts actually. Where we're struggling to recruit, that's an opportunity potentially for a non-registered member of staff to upskill. So I think it's just about starting to have those thoughts and those ideas really. Gabby, did you want to jump in?
No, I was going to say the same actually. It's thinking about, what have we got now? And how can we deploy differently? How can we look at new models of care? And as I mentioned, in terms of roles and responsibilities in the toolkit, one of the key questions is that can you identify tasks or activities that could be delegated to support workers? Can we think a bit differently? But I do think I agree with Richard. You then need that business case, don't you? And also some of the impact stuff, the economic impact stuff that Richard was talking about earlier, actually, that feeds into that business case.
I was just going to say, I think that's quite valuable because in any business case, people want to see an outcome and a benefit, don't they? And I think that sort of work could actually be very valuable in those business cases to really prove cost effectiveness as well. Are you happy to share that, Richard? I'm just wondering whether it's something that I can send round if people are interested in.
Yeah, I put my email in there, but actually, Abby, if I send it to you as well, then people can get it from either source. And I've just noticed someone's already emailed me, so the email's obviously working. So please feel free through either route, but I will send to you.
Super, no, I'll distribute that as well if people would like that. So super, thank you. We got any more questions? Anyone wants to pop hands up or pop any questions in the chat? Questions come up from Amy. Which universities in the southwest currently offer an apprenticeship programme? So there's lots of different ones. So we've collated a list of different universities and different organisations that do offer apprenticeships. So if that's something that's useful to people, then we can pop that in the distribution list as well and send that round. So you've got a list of all the available ones. Any other questions? I'm just thinking what we might do is if we go on to Lorraine's presentation, it may be that brings up some further questions. If Richard and Gabby, I'm not sure if you're able to stay on till the end for any other questions. Super. Is that all right, Lorraine, if I hand over to you?
Thanks, Abby. Thank you. Thanks for inviting me back again. I'm sure you'll be sick of hearing my story so soon. Lovely to be here and talk to you all about my career journey. And can I just ask you for the next slide, please, Abby? Oh, actually, sorry. No, would you mind going back? Sorry, I've jumped a bit too quickly. Sorry. What I was thinking was actually that I'm actually a product of a career change and grow your own. So my NHS career started as a career change. I was actually a chef in a previous life and had a young family and decided that I wanted to have a different career. So my NHS career started as an auxiliary nurse in day case surgery. And I wanted to progress after completing an MVQ at level 2 in health and social care. So I looked to see what other opportunities there were outside of nursing, and I found AHP careers. Didn't know that you could go into AHP careers as a support worker. So I was actually fortunate enough to apply for an assistant, a therapy assistant as a band 3, currently here at the Dudley Group. And through experience, on the job learning, I was able to then apply for a band 4 therapy assistant practitioner, and that was in elderly care, acute services, frailty and front door. I loved my job and I loved being a support worker, and I knew that university wasn't going to be a route that I was going to go down. I've got a young family, different home life commitments. But I always looked to the register staff and felt I wished I'd got the opportunity that they had to make a difference to the profession, because I felt as a support worker that I didn't, because I hadn't got a registration, I hadn't got a degree, and I felt all these barriers. And a lot of that was my own perceptions around making a contribution to the profession. So what I did was I looked outside of my organisation, and I looked to the Chartered Society of Physiotherapy to see what opportunities were there so that I could make a difference or contribute to the profession. And I got myself involved in a focus group, looking at development opportunities for what associate members wanted for their development. I also got myself involved in the review of their annual representatives conference, and I actually took part in presenting at that conference. The review took place, and basically the conference, if any of you are physios or go to that conference, I can just expand a little bit more. It's a debating conference which is member-led organisation, and it informs council of what is important to members about the profession. And working on that review and working within the ARC Agenda Committee Council, that opened up my world really in terms of learning opportunities. It got me to think differently about the profession, the issues around it, and that could be around workforce, global health issues, education, environmental issues, anything which was important to the profession. So it really contributed to my learning. I learned a lot of being part of this review, and I worked with a wide range of people from different clinical backgrounds. And they were all in, what was our common ground was that we all wanted to shape the future of physiotherapy and the profession. I also learned that I didn't need a degree to be part of this work, and my voice and contribution mattered. I also then had the opportunity to look a little bit more closer to home, not just on a national scale, and I joined the West Midlands Regional Network of the CSP as a core team member, and I've recently been appointed as the co-chair of this network. We host events for members, and they're either through the pandemic, we held Zoom. We are also planning face-to-face events, and we had topics covered which are things around challenges to international recruitments for physiotherapy, coming to work in the UK, what's important to recruiting managers when recruiting international recruitments and how we can support them, and also other events around opportunities for AHPs and physios within the new ICS systems and leadership clinical roles, and thinking differently about leadership and thinking differently about AHPs and physios. All of this has given me a greater understanding of the governing body's influence and what members can influence to the profession. And I've had many training opportunities through the CSP. I've had some influencing training paid for, and this really helped me shape my understanding about the power of influence, creating and thinking about my stakeholders, who my audience were, and how I was going to target them. So whilst doing all of this work in the early days, I did not think of myself as a leader. I just wanted to contribute to the profession and make a difference, and I still do. And through this work and through wanting to be an advocate for support workers and being taking these different opportunities, I was actually nominated for a national award for a rising star with a rising star for an allied healthcare professional support worker in 2021. So throughout my development, I've took many opportunities. I've had coaching sessions, which really helped me with my leadership skills, with chairing meetings, having difficult conversations, reflective practice. I've never underestimated the impact this has helped in me, because this really shaped my development. It's helped me shape me being able to take on the new opportunities of a lead AHP support worker once that became available to me. Can I put the next slide, please, Abby? So as a lead AHP support worker, I got the opportunity to start as a secondment, and in January of this year, I was actually successful in the substantive post. But what I wanted to talk to you about, which was really important to me, was what does the role mean to support workers? What does a lead AHP support worker? How does this impact to support workers? So what I've done some of the things I've done to date was the introduction of the care certificate for AHP support workers and contextualising that to be specific to their work. We've had some educator training for support workers for Birmingham University to support students when they come on placement. We've got an AHP support worker forum. We've also got a system-wide focus group. We created CPD events internally and externally to the Trust in collaboration with other ICS faculties. We created shadowing opportunities and career conversations. And that's just a few, just to give you a flavour of what my portfolio brings for support workers. Next slide, please, Abby. This is the voice of support workers, which again, I think is really important. What do support workers think this role means to them? And this is, for me, really important to get their feedback. My role should be really shaped around what their needs are, what their development needs are. Connecting support workers through events, setting up a safe space for support workers. Lots of support workers have never had the opportunity to come outside of their area of work, and connecting them with other support workers, they suddenly realise that we're all in the same boat together, really, and actually we can shape our opportunities together. Being an ambassador for support workers, knowing that I can translate the language from higher level meetings and bringing that information back down to support workers in a language that means something to them and that is relevant to them is really important, and also being a mentor for them. Next slide, please, Abby. Again, this is some more feedback about support workers, you know, saying that I can see the potential, helping, encouraging them to seek out opportunities, understanding that I've been in the same position as them so that I can support them because I understand what it is. I'm a support worker leading a support worker. Next slide, please, Abby. And again, understanding the impact of the role from a manager's perspective, I think is really important so that they can see the benefits, that it helps their team, it helps their service design, it helps them think about what skills that they're using. And as Abby alluded to earlier, not Abby, sorry, as Gabby alluded to earlier, thinking about your skills, Mick, if you've got difficulty in recruiting and you've got vacancies at band 5, then absolutely you can look at your skills, Mick, and think about a band 4 role that can support your vacancies within your team. And also linking in with support staff with regional and the national events that are happening, and encouraging them to get involved and feel included. Also, people have said that they find that it's inspiring, and I can support them with the benefits to staff and patient care. Next slide, please, Abby. Any questions from anybody?
Thank you, Lorraine. I think you're going to start blocking my email address, aren't you? Because for Lorraine, I've asked to present a lot of different things recently because I think it's lovely to hear that inspiring story and that really powerful story. So thank you so much for presenting again.
Oh no, it's a pleasure. I you know, for me, the programme really, it's opened up another pathway for support workers because it actually show that there's now a leadership element for support workers as well as developing them within their own role. So I really would like to see that embedded more within trusts, that support workers can see another element to their development.
Brilliant, thank you. We've got about half an hour scheduled left, so we've got plenty of time for questions if anyone wants to bring any questions up. There's a question in the chat, Lorraine. I think you might be being volunteered for more presentations. So would you be able to present for different teams, a wider level or trust level?
Absolutely, more than happy to. I'll pop my email in the chat.
That'd be great. Thanks, Lorraine. Any other questions from anybody? Oh, that's a very long question from John H. come in. I won't read it out. I'll let everyone read that, and then.
Sorry, I was typing that away in anticipation, and it grew. So I can ask it if you like.
Yeah.
Go ahead, Johnny, if you're happy to.
yeah, it's just I guess one of the challenges I've noted is that other areas that maybe have a mix of traditional AHP support worker roles and maybe other kind of nursing associate roles, or other areas like health improvement practitioners. They maybe have different requirements of educational levels, or often have the subjective or equivalent level of knowledge and experience in the person spec essential criteria. And these areas may be less linked in with that AHP career development framework. So I think the feedback from AHP team leads is the concern from an operational level. If they specify those, the level 5 learning as a requirement for the Band 4 AHP roles, they might lose potential recruits to other areas that don't specify this. Or linking back to, I think was it Hannah's concern, I guess, is that the 2-year assistant practitioner apprenticeship course leaves services short in the short term from an operational level. So it's just any advice on how we can kind of talk to team leads about that. And I think some of the points you've already made about making that economic case are quite strong. I just wondered if you had any other advice really to take back.
Shall I kick off on that? I think I think the good news is that competency frameworks are beginning to be developed in other areas. So as I said, some of these issues around consistency and standardisation and some of the problems are not unique to AHPs. So some of those other areas that you mentioned, work is underway to try to standardise in a much more consistent way. And I think the issue we have is support worker roles are being developed very much by local employer decisions, which is why we have this inconsistency. There's been very little national guidance other than with nursing associates, although there is research showing how nursing associates are deployed actually varies by setting. So even with them, with national guidance and regulation, there are some differences. We try to be flexible in the framework around education. So as Gabby said, it's not an expectation you would automatically have those qualifications as soon as you enter employment, that you would have the opportunity to gain education once employed. We really, going back to the grow your own, we really didn't want to restrict access. We recognise a number of people for lots of reasons may not have acquired. I mean, I left school at 16 with very few qualifications, to be honest. But we know there are other people who have kind of barriers, as I was talking about earlier. So we've tried to be flexible and also recognise that experience does matter. But equally, when you get to the higher grades, there is a real issue in terms, for example, if you are going to do that assistant practitioner apprenticeship, you do need as an academic qualification. So there is a need for a certain level of academic qualification and functional skills to kind of do that higher level. So we were a bit more restrictive at the higher level. Job evaluation profiles, I think it's not controversial to say, are not as up to date as they could be always, and there's beginning to be pieces of work with the job evaluation group around a suite of profiles, and I hope that will over time lead to more consistency between roles. But it is an issue. I'm not denying it is an issue. There are inconsistencies. The guide of the framework, is trying to take account as far as we could of all those other frameworks that exist and have been around, like Skills for Health's one, which came out in 2010, as well as the job profile. So we've tried to make it as flexible as well as grounded on what we'd kind of expect around safety and minimum requirements for people. That's not an easy answer or short answer to the issue you're dealing with, but hopefully it does give a bit of room to be flexible, and hopefully around some of the other work that's been done around support worker competencies and entry requirements, that will bring people to a much more consistent level and standardization, because this is the problem. It is not standardized. It will vary between, I mean, some places might vary within organizations, let alone between occupations and different ones. So we're not where we would like to be yet across the NHS, and I think the AHPs are ahead of the game and trying to be as consistent as possible within those AHP professions. We have also just finally tried to think about blended roles as well, so not just uni professional support workers, but AHP support workers that maybe have some physio, some OT, for example, within their roles. But again, I'm not sort of pretending this is a straightforward situation because of where we are with workforce planning.
Well, thank you. I mean, that's just reassuring in a way that it's you know, that work is underway, and I guess it's a strong argument to say to justify why, you know, we need to draw a line somewhere and start somewhere with this, don't we? To try and get that consistency. So
yeah, and I think particularly those higher levels I think there was a good argument you can make around the ability to acquire those qualifications. So, you know, I'd be surprised if someone else was looking for an assistant practitioner role where there wasn't any sort of indication around the qualifications that would be expected at that role, because there's a high level support role with a degree of autonomous working, if not, you know, under supervision, yes, under delegation, yes, but you know, there's much more kind of freedom of operation with assistant practitioners, so you would expect a degree of academic understanding at those levels particularly.
thank you.
Thanks, Richard. And Hannah's just popped in the chat that there are other services such as hospice that are offering Band 4 roles without the AP qualification. I think everything you said just really builds on that, but this is a starting point for consistency. It's not going to change things overnight. So we will still see those inconsistencies, but hopefully we'll start seeing them much less.
I was just going to add, in terms of the apprenticeship stuff, and sorry, you were mentioning about an AP apprenticeship taking 2 years and then the time out clinically, and how services manage that, because that is something that we hear a lot, and we're aware that that is hard because workforce staffing is very tight at the moment. It would be worth looking to your talent for care lead, and off the top of my head I can't remember who it is. Andrew, if you're on the call, would you mind just popping, or Abby, do you know who talent for care, because they've done a lot of resources, guides, business cases, sort of economic impact stuff like Richard has for our program. So it's worth looking to them, because they've produced quite a lot to help services around that issue of backfill and not having people in. So they might help as well.
He's called Andrew and I can't remember his second name. It's a double-barreled name, but I'll find it and pop it in the chat or send it round as well.
Oh, is it James? Is it James?
Sorry,
oh,
James.
No, it's
It's not Andrew. It's James Orpin Wright. Yes.
That's it.
It's not Andrew at all. Sorry, completely made that up. Do we have any other questions? Anything? Just popping in James's email address, so that's in the chat. There's no further questions. Obviously, we can close the webinar, but I think most importantly, you've got my contact details. If there's anything you want to come to me directly about, then I can send it on to the relevant person or to Gabby or Richard. From a regional perspective, I don't think Andrew is on the call at the moment. So Andrew Morgan is the Southwest regional HEE workforce vet that's working on this. So Andrew is a very good port of call as well. So if you've got further questions, obviously come to us, come to your AHP workforce lead within your organisations, because they'll be doing an awful lot of work around that. We've got a few of those on the call today as well. So there's lots of people that are doing work around this, but if you need further information, then please do come to us. I'll send round all the links that Gabby and Richard mentioned. I'll send that round in an email, as well as if you're able to share the economic evaluation, Richard, I think that'd be really useful. And I'll send round the available apprenticeships in the Southwest / Devon, so you've got those available as well. Yeah, I think if there's no further questions, thank you everyone for coming. Massive thank you to Gabby, Richard and Lorraine. I really appreciate your time. I think it's been really useful. So we'll share the recording on YouTube so other people can access it as well. But if no further questions, I say thank you very much. I'll hang around for a bit if any other questions, but other than that, thank you very much and have a good rest of your afternoon.
Thank you.
Okay.
Thank you.
Thanks.
Thank you. I'll speak to you soon, Abby.
Thanks, Lorraine. I'll stop nagging you for a little bit, I promise. So,
No,
but
no,
many
it's not
thanks.
nagging at all, honestly. It's fine.
I think it's really useful just for people to see the kind of roles that can be created. I think that's really valuable. So, and the work that you're doing, I think, is extremely valuable. So, yeah, really, really appreciated. Thank you very much. I think that's most people gone. So, if there's no other questions, I will leave you all be. Gabby, thank you very much for coming as well. And
Pleasure.
take care. We'll see you soon.
Yeah,
Take care.
June. See ya.
Bye.
Okay.
Bye. Bye.
Bye.